PRP stands for platelet-rich plasma, and that is a natural product that we actually get from your blood. It contains platelets, which are the body's natural growth factors that go to any part of the body and stimulate healing. And what we've found over the years, as it's been injected in various tissues of the body, is that it causes regeneration of the tissues and in addition causes decreased pain. So we are now using it in many tissues of the body to reduce pain and also regenerate tissues and cause healing in body tissues that normally don't heal very fast. We draw blood from your arm, process it in a centrifuge to spin out and concentrate the platelets and thus get platelet-rich plasma, so that's part of the blood. We discard the parts of the blood that don't have anything to do with healing, and we inject that with very precision injections into whatever body part we want to cause healing with, whether it be a shoulder, a knee, a hip, or any tendons of the body that have any kind of damage or pain coming from them. The procedure itself takes about an hour and a half to 2 hours from start to finish, and that goes from drawing the blood, processing it, going into our procedure room and either using ultrasound or fluoroscopy or live x-ray to do the injection, and then a short recovery time afterwards. We've had very, very good effectiveness on all our patients. In fact, I've had treatment on my elbow. I had tennis elbow for probably about 2 years, not finding anything relieving of it all, to the point that I couldn't really use my arm very much. My grip was very off. I did one treatment, and within about 4 weeks, it pretty much went away, and it stayed away, and it's been 1.5 years now. We've had patients go at least 1 year, some of them 2 and 3 years, and some patients we have never seen back. When we've called them, they're still having good relief.
I came to PainCARE because my doctor wanted me to have surgery on my meniscus tear, and I didn't want to go through surgery again. The pain affected me in every aspect. I couldn't walk for long distances. I garden a lot and I couldn't do that. Just walking to and from work from the parking lot, it was horrible. I had other injections, steroid injections done by an orthopedic doctor, and they were very painful, and it didn't last, it didn't work. When I came to PainCARE, the process was a lot easier. The injection was done under x-ray and it was a lot less painful. I was able to go back to yoga, and I've been doing that, and I believe it's helped my knee to be even stronger in the healing process.
The risks of the procedure are actually very, very few. Since we're using your own body's tissues in the form of blood, there really is no allergic reaction. There's no overdose that you can have like you would with a medication. And there's no real tissue reaction of any kind. The only thing we see with it with any regularity is it does tend to cause a little bit of flare of pain shortly after the procedure, and depending on what type of injection and what type of tissue we're injecting in as to how long that lasts. It's usually very short-lived, in the order of days. The cost of the PRP, in fact, is very comparable or even less than the co-pays that someone would pay for surgery. So we do see a very, very good cost savings with doing this in place of surgery, as well as the downtime associated with it. The downtime that we have from this is very, very short, certainly much less than surgery, as this is an alternative for surgery for many, many patients. Usually what we do is we ask the patients to not perform any kind of strenuous activities that would strain whatever body part we're working on for a period of time of up to 2 weeks afterwards, and after that gradually get into movement exercises after that.
5 years ago this July, I had an arthroscopic surgery to remove cartilage chips from my left elbow from trauma received during work. I'm a large animal veterinarian. I had my elbow continually hyperextended doing obstetrical procedures in large animals, horses and cattle. I would have to ice my elbow down at night until it became numb to fall asleep. It was debilitating, difficult to concentrate, and of course difficult to get sleep. and without the sleep, I don't function that well. My chiropractor suggested that I come to PainCARE and try the PRP. And after 2 weeks of the injection, that pain associated with the elbow joint itself had gone away. Had I known that this treatment was available 5 years ago, I never would have had my elbow surgery. Now I can get some sleep and feel rested when I go to work, and usually put in a pretty productive day.
Typically with the injection, we use a local anesthetic and we try to go very slowly when we do it. We numb up the skin, so there's a minimal type of a discomfort that happens with the injection like you would with any injection. And again, after the injection, there may be a little bit of a flare from the pain just because we're putting the medication into a certain area that may be very, very sensitive. Any ligament, tendon, or joint that we have that has pain from typically weakness is what we see, and degeneration. So we're doing a lot of injections into knees and hips and shoulders because those tend to be the parts that people wear out. We are doing it now primarily as a treatment of people that do not want to have joint replacement surgeries or are not candidates for surgeries due to other health issues. We've been very, very successful in relieving pain from patients that thought surgery was the only answer they had and had been told by their surgeons that it really was their only alternative, such as bone-on-bone or torn ligaments, rotator cuffs, labrum tears, things like that. Surgeons in other parts of the country I know of are treating patients post-surgery to try to relieve post-operative pain after types of surgeries such as Achilles tendon surgeries, knee surgeries, and hip surgeries. Routinely, they will go in at approximately 6 weeks after you expect most of the healing from a surgical repair to be going down and treated at that time, and they do seem to improve much greater afterwards, and their recovery time is much shorter. We can typically treat anything from someone in their teens all the way up into their 80s. And we have treated patients well up into their 80s with excellent results from it.
My hips have been bone on bone for years. I had hip surgery on the left one. It was a long, painful recovery, and it left all that surrounding muscle weak. When the right one became too painful, I was not looking forward to another surgery. I couldn't grocery shop or stand at the kitchen sink. My sleep was no more than a couple of hours at a time because the hip pain kept waking me up. My daughter had Dr. Bruning do PRP on her knee and had great results, so she suggested that I try that first. The PRP procedure was easy. Within about a month, I was back to hosting dinner parties, and I'm even going on a walking trip to Ireland with my daughter in September. I'm so glad not to have a second hip replacement.
For patients interested in financing, we offer a 6-month no-interest same-as-cash program through CareCredit. Please check with our front desk receptionist for more details.